acid reflux is often common, or acid regurgitation or heartburn. So in the Western medicine, acid reflux is acid from the stomach leak out to the esophagus due to the weak muscle of the divider between the esophagus and the stomach, little bulb that opens and closes, and then when that muscle is weak, they leaks out. GERD or GERD is acid reflux when it is chronic. Heartburn is a symptom of acid reflux, and other related symptom is the bitterness in the mouth. When you wake up, especially, it's bitter because your gastric juice is cooked. So cooked gastric juice come up to your mouth and then give you the bitterness. Bitter mouth is like actually not that uncommon. I see that all the time. Chest fullness and breathing difficulties as well. But that's just because you have a chest fullness, that doesn't mean you have and breathing difficulty, you have an acid reflux. But if you have an acid reflux, you probably have a chest fullness, I assume. Okay? So how the acid reflux happens in Chinese medicine? I tend to think there's two ways that happens. One, dry stomach due to insufficient body fluid. Here, this body fluid is the gastric juice. You can think this is a gastric juice. Body fluid is everywhere in your body, but because we are talking about stomach, this is the gastric juice. So acid reflux before eating or drinking. This is harder to treat actually, because the treatment principle is to nourish the body fluid, nourish the gastric juice. You're dry, that's why you don't generate the gastric juice. So for me to lubricate your stomach and then generate the digestion and then generate the digestive fluid is a bit hard. Acupuncture only wouldn't do. I never had a success case that I only had acupuncture and it worked. You need a Chinese herbs. Because only substances can nourish the substances. If acupuncture uses mostly your own energy and a little bit of the mind, but not too much. So acupuncture only wouldn't be sufficient. You are lacking digestive fluid, then you have to bring it from somewhere. So that's this side of the stomach. It's just empty. Without the healthy digestive fluid, you wouldn't feel hungry. So those people, this can be, when it's at the beginning stage, your appetite for the breakfast will be lost. You wouldn't feel like eating breakfast. You may just only want to drink coffee. And then you can, okay, I skip breakfast. I'm okay to eat by lunchtime or 11 o'clock or by 3 o'clock, or I only eat supper. Many people only eat supper. That trend of intermittent fasting is not meant to be every day. It's really bad. So people like with the beginning of this stage, like I don't eat breakfast, but I eat a big appetite for supper. They may say that often. Not many people can eat their breakfast right away. If you can, consider you're good. Prognosis of whatever you're having is good if you can eat breakfast. So excess dampness or damp heat in the stomach. So that's this side, okay? It's there's like dampness here. Again, you have pizza, and then it doesn't go anywhere. And then this way, there's a pylon here, so it goes up. It goes where it comes from because there's no other. If the exit is closed, they'll come back away from where it came in, right? So acid reflux after eating or drinking. This is better, this is easier because I just need to get rid of the dampness. When the dampness stays in one place, dampness knows that they shouldn't be there. So it tries to move away, but there's nowhere to go because there's a pylon here. Then the dampness try to move, and eventually the effort, the movement causes friction because it's trying to do this, trying to move. The effort and the movement causes a friction.
Are you talking about peristalsis?
No, we are not there yet. Peristalsis happens in the intestine. This is the stomach.
Okay.
Stomach dampness also. Stomach is where the life stirs. So when you have a pathogen of dampness, your body does everything they can do to send the dampness away from the stomach. Often it goes to lower because the gravity. Dampness is a invisible, but it's a substance, so it sinks because we have a gravity. So you may have a frequent urination, like I go pee, like I have a small bladder. That's what people say. Or you may wake up a few times at nighttime for urination. Or you may have constipations, or you may have fibroids, or any damp system around here. And when it passed, you have a water retention in the leg. You have a heavy leg or cold leg because damp sinks. For some people, for other people, it goes to the surface, to their skin layers. Skin layers. So then they will have like a puffy skin. If I eat gluten, I'll get puffy face. That's what people could say for these things. Mm-hmm. Or my joint hurts if I eat pasta or something like that. But when it becomes a damp heat, there's a little more heat. This is like a gout, it's a major damp heat. If I eat like a duck and wine and steak and then this and this and this, all the indulgence, then it will cause the dampness and then it wouldn't move, so it causes the heat and then it will just contain in one area. And then it could be rheumatoid arthritis, or it could be gout, or it could be, if it goes all the way to the skin surface, it may be eczema. Like if I eat wrong things, I'll get hives, something like that. So stomach does its own best effort to send things somewhere, but the exit is blocked, like this case, then it will go up easily.
Acid reflux.
Then it's called acid reflux after eating or drinking.
What if you get it both?
It happens. Then I'll give you the herbs for this one and this one. This one though, that doesn't happen as often. I don't carry the medicine for this actually. 2 herbs that works for the acid reflux before eating or drinking is the herb is called, the formula is called the ube-san, and one of the ingredients is a cuttlefish spine, the bone of the cuttlefish. You know cuttlefish? It's a squid with a bone. And because I'm a vegetarian, I try not to carry those. If somebody has it, I'll go get it, but I don't always carry the cuttlefish spine in my office. And then for dampness, acupuncture does work. You should have a Chinese herbs for the efficient treatment, but the moxibustion, like the bundle of blood tummy one, or acupuncture works. For this one, I will do the moxibustion that I do with like a rice. So the tummy one is the size of this size. Cone is this size. But for this one, I'll make a cone of the rice size and then put directly on below the knees without ginger. And I'll probably do that for 20 minutes. Like light it. I'll light, extinguish for the 1 point on below the knee, and then that will generate body fluid, and then you will feel immediately hungry. But intestine, probably if you have leaky guts, your stomach is not healthy though. It's rare that you have a healthy stomach, but the pathogenic intestine, it's usually a set. Yeah. So if you have leaky guts, most likely you probably have this one, because you wouldn't have a leak. You don't have anything, you don't have a fluid when you're dried stomach, right? Yeah, you probably would have like a constipation, dried constipation, yeah. But this one, you can easily leak out from the intestine.